Today is International Midwives Day. The day is observed globally on the 5th of May. The World Health Organization has designated 2020 the International Year of Nurse and Midwife. Health MEC in Gauteng Dr Bandile Masuku earlier joined the midwives at Hillbrow Community Healthcare Centre as part of the Employee Value Proposition program. All right, for more now on the day, we joined via Skype by Gauteng MEC for Health, Dr Bandile Masuku. MEC, good afternoon to you. Thank you so much for joining us here on the SABC News channel.
Good afternoon, and thanks for having us on your show.
Now, I suppose really there is no better person than yourself to tell us more about the importance of today being International Midwives Day. I say so because I know that you specialized in obstetrics as well as gynecology.
Yes, you know, they played a very instrumental role in my life, also as a professional. I did tell the story about how I became an obstetrician. It's because of the influence I got from the midwives in the former old natal spread in Gauteng. And also my first block of rotation after qualifying as a doctor, as an intern, it was in a labor ward in Charlotte Maxwell. So basically, I have got a very fond memories about what they taught me, the knowledge that they've imbued in me. And I think this is the 7th year that I celebrated. We started off in 2013 when I was a consultant at Chrisani Paragwana, which ever since I've been doing it annually in whatever role that I've been in.
So let's just talk about the challenges that that particular unit perhaps faces as we commemorate the day today and celebrate, one can say.
Yeah, I think the major issue is the issue of understaffing. You know, that's why we are in a role of making sure that we are able to employ a whole lot of new nurses and particularly the midwives. Because in terms of the numbers that they deliver every year, it's a very huge number, and it's something that we need to work on to make sure that they don't get burnt out or even fatigued. So it's something that continuously will create a particular space and be able to employ enough midwives in the whole process.
So this morning you were part of the Employee Value Proposition program, as I said, at the Hillbrow Community Healthcare Centre. Talk to us about what this particular program is aimed at.
This program, we initiated it when we started our term of office because we realized that the staff morale in the department is quite low, and our staff they go around without being acknowledged and appreciated. So the EVP, when we launched it, was launched in a basis of making sure we acknowledge and appreciate our healthcare workers and our staff in our facilities, because they are the ones that carry, the whole care system in the country and also in the province. So it's going around. It's also just about provision of tools of trade for those who are working in our facilities and also providing career pathing for them to be able to grow within the department. So it's a very a big program, and we are continuously building it up so that it can be able to improve the staff morale in the department.
And I suppose surely you must have had some interactions with midwives today. What came out of your interaction with them and perhaps your engagement? What are they saying?
I think besides the challenges that they shared with me, the challenge that they are facing of being understaffed and burnt out and fatigued, they also appreciated the fact that as a department, we acknowledge their presence and their worth, and that we are also making a commitment with them that we are going to work in making sure that we make their environment and their work environment conducive. Next week, when we celebrate the Nursing Day, Nurses Day also, we are going to do the same with all the nurses. The special thing about the midwife is that they will be celebrated twice, firstly as midwife and secondly as nurses. But it's all about addressing their challenges and addressing their plight.
The day is being celebrated today in the midst of this coronavirus outbreak. What sense did you get from this midwives when it comes to the issues around them having to do their job at the same time having to take precaution against COVID-19?
I think they are known as a very committed bunch of healthcare workers, and their dedication in us making sure that we overcome this equally invisible enemy. And something that they said to me, which I have to make sure as the MEC, is that the provision of the protective, personal protective equipment is always available for them to be able to protect themselves, because we won't be able to have a healthcare system if they will actually get infected. So that is our preoccupation. Everything that we will be doing, procuring, or even donations that we are receiving should be around addressing that blight on the PPE.
And the day MEC is also being commemorated in the midst of, as I said, the outbreak of the coronavirus. And we've seen and heard of a couple of cases where babies were born from mothers who had tested positive for COVID-19. Just explain to us as to how is COVID-19 or this coronavirus transmitted from mother to child?
There's a number of unknowns about the COVID-19, as a disease entity, and a whole lot we are still trying to get. But we know that there's little transmission in terms of breast milk, even in terms of the placenta transmission. But we know that the virus itself does affect the growth of the baby because of the infection that happens on the placenta. But there's still more that we have to learn with the virus as it relates to pregnancy.
All right. So just before I let you go, let's just recap on the numbers when it comes to the positive cases of coronavirus in Gauteng. Are we still at 1,661 confirmed cases and 1,026 recoveries?
Yes, I think we are going to get the new numbers from the minister. Remember that he's the only one who's authorized to make any new infections or declare any new infections. But we are making sure that we are continuously testing, because we need to find a whole number of individuals who are infected in the whole process.
All right, ABC, we'll leave it at that. Thank you so much for coming through. Gauteng MEC for Health, Dr. Bandile Masuku, joining us there via Skype.